And thank you for joining us this mission-oriented innovation workshop on personalized medicine to optimize cancer prevention, diagnosis, and treatment. This workshop is hosted jointly by Vision Zero Cancer and the OECD Observatory of Public Sector Innovation. And we have a jam-packed program of 2 days. Today we will start with opening remarks from Vision Zero Cancer, OECD, and the European Commission Mission Board for Cancer. We will hear an overview of Vision Zero Cancer and their role, and then an introduction to the concept of mission-oriented innovation. Later this morning, we will hear from global examples of mission-oriented innovation in the health space, and there will be a chance for you to reflect on the mission's approach. I'm very excited for a illustrious panel discussion at the end of the day, where we will discuss how a mission's approach can support cancer prevention and care in Europe. And I hope you can also join us tomorrow on day 2, where we will have a more interactive workshop, and we will invite discussion on signs of success for the mission, as well as how we can achieve the mission in practice. So to kick off the workshop, I invite Piret Tonorist from the OECD Observatory of Public Sector Innovation to start with some opening remarks. Over to you, Piret.
Thank you so much, Chiara, and welcome everybody to this Missions Bootcamp. In 2020, 2.7 million people in Europe were diagnosed with cancer. 1.3 million people lost their lives to cancer. The problem is much larger worldwide. So this is a really worthwhile purpose and topic to actually work together on. And we are very happy at the OECD that a purpose-driven, impactful approach to these kind of topics has been picked up on the European level, but also on the global level, based on a mission-oriented innovation approach. What we mean here by missions are really purpose-driven, ambitious tasks and outcomes that we really want to commit to achieve. So these are nothing that are only simple things that we want to improve on, but these are things that we actually want to solve. And we need to also innovate collectively and together to actually make that work. And it's very glad to see that in addition to the European Union commitment to actually solving and working on cancer that others will talk about in detail after me, we also see a leading example from Sweden that we can actually, from the OECD side, learn from on how to adopt an ecosystem purpose-driven approach in this very, very important field. That we actually start a paradigm shift in healthcare based on personalized medicine, that we can have tailored approaches and more impactful approaches and equal access to diagnosis and treatment of cancer across Europe, but also across the world. And it's great to see the Swedes actually leading on this as well. So taking a very ambitious approach to a Vision Zero Cancer and actually solving these issues together. While this ambitious task is already being taken, now is the time to really commit and assign responsibility to taking up and implementing that vision. So working together today during this bootcamp, we're really looking forward to your perspectives on how to make this work. Who needs to be doing what? How this ecosystem can be activated and synergies across different innovations and different actors being made transparent. So we end up with a mission-oriented innovation portfolios that are synergistic and moving towards that purpose that you have taken up for yourself. And we at the OECD, together with the Mission Action Lab, are really interested in this, in terms of the mechanisms, tools, and practices that can actually create a successful conditions and a governance system that allows you to exceed in this important task. We're looking forward to working together also with Europe and the mission board there on terms of cancer. And there a plan for beating cancer in Europe as well, with the deadline of 2030 to actually make a real difference in the lives of people. I'm going to hand it over now to Bettina, who is going to tell us about what the latest developments in the European Cancer Board are and the commitment they have made to this field. Thank you so much, and looking forward to working together with you today.
Thanks so much, Berit, for that introduction. Good morning to all of you. Thank you so much for showing up and for signing up for such a program. I think we all have a bit of Zoom fatigue after 2 years of sitting at home. So I'm actually particularly honored to introduce the workshop here today. And before going a little bit into why I'm so excited about that, a few words about myself for those who don't know me, because I have different perspectives and they're all relevant to the discussion here. So by training, I'm a trained physician and molecular biologist. So I've spent a couple of years of my life in research, fundamental research, first in the UK, where I did my PhD at the University College London, and then in Sweden, where I worked as a researcher. So a lot of my perspectives are very much medical and research driven. Then I started a European patient network after losing my husband to melanoma about 10 years ago. And what I built is not what you would expect a classic patient organization, but something that just delivered on what we needed. And we just did a lot by experimentation and learned from it and did more of what worked. And it took me a few years and meeting, for example, Pirit and her colleagues to realize that what we had used was a mission-driven approach, just that we never called it like that. So I do have some practical experience how this looks like in a real world setting without any theoretical background to that. And last but not least, I've been a member of the Cancer Mission Board for the last 2 years. I have been the one who has been predominantly writing the recommendation for personalized medicine. So you will see the link to this topic. And I am delighted and honored to have joined the Swedish cancer vision, which is called Nollvision Cancer in the last year, actually, and to see how different concepts play out on a European level, but in the end, we know that health happens at national level in a real world setting. And so I'm delighted and honored to be here. And I think I'm looking forward to these 2 days with all of you, because I actually know many of you, and I know that you also care about cancer as much as I do. And therefore, a few words why I think this is such an important event. So many people, if you think about healthcare, we often think of it as the interaction between a physician and a patient. And many people discuss healthcare as if that was the only thing that existed. If you go looking with a little bit more detail and scratch on the surface, you see that this relationship actually consists of usually a process of a diagnosis, a decision-making, and a treatment and an outcome. If you then go one step deeper, you can say a diagnosis will include a physical exam, but it will also include laboratory, it will include imaging. Someone has to provide the tools and the methods for both the lab and the imaging, and then you go one level deeper and one level deeper, and you can do this at any step. Treatments, someone has to produce these treatments. Where do these treatments come from? There's an entire industry around that. The bit in the middle, decision-making, is becoming more and more important. There's even an industry developing around that. In the olden days, we would meet a barber at a local country fair. That's no longer the case. We now meet our physicians in a setting. These settings have to come around from somewhere. So there's an entire infrastructure in health that is important. One patient is a simple interaction, but seeing many patients come with challenges at their system, how to organize that system. A single patient is not just seen by one specialty, but many. Health is a highly regulated space, so we all influenced by laws at many different levels. We also influenced by global perspectives on this entire setting. So I think all of you will agree with me if I state that health is a complex system. Many of you have been in this space for a very long time and have been trying to change things for the better, because I assume that otherwise you wouldn't be sitting here. So what we have realized, anyone who has tried to change anything, is that you change a little bit here. And what happens then is that the change ripples through this entire system and sometimes causes things that we didn't expect, that we didn't foresee, that are sometimes what we wanted, but more often it is something that we did not want. But in the end, the system always returns to some kind of stability because it adapts. And actually an accurate description of this entire system is an adaptive complex system. Now, I had actually been thinking about drawing this as a slide because they always say, visualize your concepts, but I actually decided against it because that would be trying to depict something that is complex as little boxes with little arrows and turn it into some engineering type of diagram, which I don't believe is reflective of the reality behind it. Because if you really think about it, this type of healthcare system does not just only exist at a local level, it also has a regional component, a national and international component. So you have to multiply this construct in your head a couple of times. So you have already added another dimension to it. And then there's also a time component. Yesterday's research is today's translation maybe, or already a therapy. Anything has a time component to it. And we kind of can have a feeling for this type of system in our heads, but on a PowerPoint, it looks terrible and it's not accurate. The reason why we have a feeling for it is that our human societies are complex adaptive systems. Biology is complex adaptive. So now you think that's all nice theory, but why does it matter? We are all here about change. And the thing is, how do you change something that is so complex and will always react to what you do in an unpredictable way? And this is precisely where actually missions come to play. Because missions are an approach to allow complex adaptive systems to move to a different and a more desirable state. Because it is important to think about metastable states, if you want to call them like that, as something of neither being good or bad. Think about human societies. We had times in history where you could own other people. Those societies were stable for a certain time. Was that, or would that be a society we would like to live in? Probably not. Usually what happens in history is that a society is stable, then usually you have a revolution or war, and then it gets replaced. So basically everything gets destroyed, taken back down to its part and gets rebuilt. That's not something we would like to see in health, because this is a European audience. I think we like to disagree on lots of different things, but as soon as you leave Europe, you realize that what we share, what unites us, is that Europe has a belief in universal healthcare. We believe that health should be there for everyone. So that is something we want to preserve. We have other things that work well in our system. So the trick is, how do we move from a system that has good parts and bad parts to something that is better by whatever standards that would be? And a mission-based approach allows to do just that. Now, you know that the European Union has launched the European Cancer Mission. There was just an update just prior to this meeting, and I've taken some notes. It's just actually the meeting is just ongoing, so the other news will be shared later on. But there is a recognition that change does not just happen at European level, but it has to filter down, and that there is a connection between the different levels we're working at. The European Commission, and this is relevant to all of you, is setting up national mission hubs. So every country will have already a coordination function, linking local, regional, national, regional, European actions all together. And it is a chance for us to be involved at that level. Now, what we're doing here in the next 2 days is, and I think everyone who has ever worked in a multi-stakeholder setting knows, you cannot just put a group of people, however well-intended, into a room and expect this to, what I call, automatically work. Good intentions are not enough. It's about finding an effective way to work together to get the change that we all want to see. Because if there's something I've realized in the last year, and I've talked to many of you in that time, is this system is full of people who really have deep local expertise. They have good intentions. Cancer is ubiquitous. We all have lost someone we love to this. Many people are really driven, have personal connections to it. So how do we get people with good intentions, lots of local expertise to work together, that we don't just put blame on each other, but actually move forward? So with that, I know that I'm over time. I very much would like to thank already at this space the team at the OECD, because they're not working. Health is not their specialty. They look at vexing problems, which turn out to be just these adaptive complex things in different contexts, and have an expertise how to deal with that. So I invite you to participate, contribute, put your thoughts, your comments, also email us on this, how we can move out of this together, and how we can come up with a methodology that will help us, hopefully today, in this concrete problem, but also in the upcoming missions that we will find at European level, and I hope we will all participate in. And with that, I would like to hand back to the moderator. And we have many people joining now, so
it's great to see so many of you on the call. Thank you, Bettina, for that introduction. Over to Hans.
Well, thank you, Bettina, for those important and inspiring words. Dear friends, good morning, everyone. I am Hans Hägglund and an MD from Karolinska Institute and professor at Uppsala University Hospital. But I'm also the National Cancer Coordinator and co-founder, chairman of the Innovation Milieu Vision Zero Cancer. I am truly honored to be here today and happy to see so many of you from all parts of the cancer ecosystem participating in this workshop with Sweden, organized by Vision Zero Cancer, together with OECD, OPSI, and for sure, Dr. Bettina Röhl from the Horizon Europe Mission Board for Cancer. I would like to give an extra warm welcome to our international friends from Australia, England, the Netherlands, Estonia, Germany, and France. In February this year, the European Commission presented Europe's Beating Cancer Plan. The aim of this plan is to tackle the entire disease pathway and is structured around 4 key actions: prevention, early detection, diagnosis and treatment, and improvement of quality of life of cancer survivors. I have also had the honor to participate as the expert to the rapporteur Birgitta Zachriadeus on the draft opinion of the cancer plan. This was presented at the European Committee of the Regions meeting natural resources in Brussels 2 weeks ago. So the Swedish cancer strategy was launched in 2009. The strategy early set up 6 regional cancer centers for knowledge management in the 6 health regions in Sweden. This kickstarted the development of a more patient-focused, accessible, equitable, and effective cancer care, with focus on patients and relatives. To mention some important activities, there are now 50 national guidelines in Sweden. There are more than 30 standardized care pathways, approximately 30 registries, and 11 concentrations of highly specialist treatments. But there are also other things done. For example, we now have contact nurses and more equal use of therapies. In Sweden, 85% of children with cancer and 70% of adult cancer patients are long-term survivors. In order to make cancer a curable disease and reach the vision, survival needs to improve by 15% in children and 30% in adults. I think by developing precision diagnostics and precision treatment in combination with more focus on prevention, early detection, and rehabilitation, there is a great chance that this can be achieved. Personal medicine will mean that cancer patients live longer and also feel better with increased quality of life when the risk of side effects and complications are reduced. I would say that there are many reasons behind Sweden's good achievements in cancer care, and they are all interconnected. One is that the cancer care is free for all. Healthcare in Sweden is a public responsibility and largely tax financed. Another is that the Swedish approach to cancer care is rooted in a long tradition of close collaboration between healthcare, academia, and the industry. A rapid development of knowledge in cancer care, medical science, and technology is now taking place. A third reason is active public health policy to prevent lifestyle-related diseases, screening programs, HPV vaccination in both girls and boys, advanced tools for diagnosis, as well as using the latest available technologies in different cancer treatment modalities, which are all important factors for successful outcome. Ultimately, the national quality registers, clinical guidelines, level structuring of care, and multidisciplinary cancer management are contributing factors. So I will finish this introduction with highlighting the Vision Zero Cancer and Testbed Sweden for precision health in cancer. Sweden have come a long way in regards of cancer care, but there are still challenges, but I would say even more opportunities. When I started as the National Cancer Coordinator 3 years ago, I identified the need to strengthen cooperation to better integrate cancer research and innovation into healthcare. Therefore, I invited people from different organizations and sectors to meet. That later became the starting point of the innovation milieu Vision Zero Cancer. The milieu is financed by the Swedish innovation agency Vinnova. A few weeks ago, we were also awarded a new grant through a call to create innovation milieus with the area of precision health. Together with the National Network Genomic Medicine Sweden and other actors, we are now setting up the Testbed Sweden. This is to stimulate clinical trials and to implementation of personalized medicine for all cancer patients across Sweden in a sustainable, accessible, and equitable way. To make this happen, we think a mission-based approach will help us. I'm sure we will have a couple of fruitful days here together, sharing knowledge and experience, learning from each other, and this will mark the beginning of a new mission for personalized medicine for all cancer patients in Europe. Let me now introduce my colleague Ebba Hallesjö Hult. She is the co-founder and leads the daily operation of both Vision Zero Cancer and Testbed Sweden. Thank you so much and welcome, Ebba. The scene is yours.
Thank you so much, Hans, for that nice introduction. And thanks to all of you for being here with us today. I'm very, very excited about that. And also, special thanks, of course, to Pirette and to Bettina for also setting the stage. Aware of the time, I will try to browse quickly through our overview of Vision Zero Cancer. Many of you are very familiar with how we started and what we are doing. And the others will, of course, catch up. And this, we are just in the early phase of starting up and learning. So that's why we're also doing this workshop together with you. So we will share these slides for anyone who wants afterwards. So I'll browse through a little bit quickly then to set about us and the role in the mission. So Vision Zero Cancer is a vision-driven innovation milieu where actors across society engage in strategic collaborations to beat cancer. We started in Sweden, but our ambition is global. And I think today's workshop is one of the examples of that. For us, it's about building a resilient society through collaboration and innovation. And just as Hans pointed out, we do have a long tradition in Sweden of working together, going from the traditional triple helix to rather a pentahelix, putting the citizen and the patient in the center of what we do, but also then engaging with the public sector and authorities for the policy to really make sure the system change will actually happen. So the Vision Zero Cancer, it's a multi-stakeholder initiative for system innovation and cancer control. We established a couple of years ago in Sweden, established through a call from the Swedish innovation agency Vinnova. We are managed as a partnership. We are coordinated by the Research Institute at Stockholm School of Economics, where we also have our office where we coordinate our work. We are founded by a pentahelix collaboration, just as Hans pointed out, when he gathered people from different sectors and an organization to see what could we actually do to a little bit more quickly adopt innovations in cancer care. So from large industrial companies like Elekta and AstraZeneca with a global presence born out of Sweden, together with the Swedish Association of the Local Authorities and Regions responsible for the delivery of the healthcare, with the Confederation of the Regional Cancer Centers, that is the knowledge management body of cancer care in Sweden. The Cancer Society made responsible for funding research in Sweden. We have lung cancer study groups, think tanks, and the patient associations, academia, and also industry associations. So we were the ones, people from those funding and starting off at Vision Zero Cancer by now we are some 40 partners engaged in different projects and activities. Our idea with Vision Zero Cancer was to create a kind of a one-stop shop to innovation in cancer care in Sweden, moving from many, we call it sort of isolated initiatives, but not working in different clusters, in different organizations and setting, wanting to create some kind of a national point of contact for the system innovation, where we can inspire, where we can catalyze, so that we can work more purposefully together to reduce the onset and transform cancer from a deadly to a curable or chronic disease. Vision Zero Cancer is part of realizing Agenda 2030 in Sweden and globally. So by doing different activities to make sure that the cancer care will continue to be delivered in an equitable and high quality way to all who need it is the foremost reason for us. And we've also been part of the consultations process for the European Cancer Plan and also to the Cancer Mission Board. We set 5 areas with different milestones where we saw the targets, where we see that we would have to renew the system in Sweden, working holistically in different initiatives, from prevention, the early detection and diagnosis, to treatment and quality of life. Around that, working with science, clinical trials, health data and registries, as well as the economic sides of the whole system change and ethics and so forth. And we have then set different activities that we started off. So for the first 2 years since we started, we have created different initiatives with different partners and actors working on different projects and activities. So everything from working, showing through studies the cost effectiveness of prevention and smoking cessation, to working with early symptoms and risk assessment in primary care, where we are also co-funding researchers in primary care. We're working actively with the stakeholder system in Sweden to push for the screening and prepare for national evaluation in lung cancer. We're also working on different initiatives to introduce patient-reported outcomes in clinical daily practice, accelerating the uptake of an IT tool for the individual patient overviews, for instance. And we are also co-hosting a national translational research partnership for precision medicine in cancer, led by Uppsala University and Professor Tobias Sjöblom with the Sjöberg Foundation, creating a network across Sweden where biobanking at the core of it, and also other initiatives also looking at how do we create the system. So we do have a researcher at a PhD student at Stockholm School of Economics actually trying to follow what are we doing to actually create this milieu. And these are just some of the initiatives that we have started. We decided to start off in one diagnosis where we see a lot of challenges, of course, but also opportunities, and that is lung cancer. But over the time and going forward, we are moving to more of an agnostic approach and also wanting to focus a lot in the pediatric cancer, but also in general from a personalized medicine approach, and perhaps also more in the forms of cancer where we see there's an even more greater need to work across sectors to achieve change. So our framework and how we came about was actually through Vinnova, the Swedish Innovation Agency, and their call for vision-driven health, with the objective then to solve complex health challenges through this type of missions approach. And kind of a test to see their hypothesis was would vision-driven innovation milieux be an effective way to achieve such an objective? So for the first years, what I think is very exciting is actually that we're receiving the funding to create the milieu. And in this first year to see how can we actually learn to engage in new ways, a little bit alluding to what Bettina said, and also Pirette, when we need to develop the mechanisms, tools, practices, how do we really work together and will it actually have an impact? It's a little bit early to say that. We do see some concrete results over the way, but mostly, I think within 5 years or 10, we will definitely see, did it have an impact on survival and quality of life? And I think, and I hope that citizens being affected by cancer will have a saying on that rather than me. So what we work with when we talk about what is a vision-driven innovation milieu, so the definition is that it's a collaborative structure with established governance mechanism that brings together actors around a common vision, roadmap, goals, and activities. So our vision is more of an ethical standpoint. When we say vision zero cancer, meaning that no one should die of cancer and more people should live longer and better. That's our vision. Under that, we're setting missions and concrete targets to work towards. And in our coordination office, we are developing and iterating, trying to see how could we work best to achieve this. So it's about the coordination work, increase and enhance the cooperation with different stakeholders, the international cooperation, drive different activities and actions that we think have an impact towards the vision. Also engagement in innovation management. It's also a lot about analysis and follow-up to communicate what we do. So that is a little bit our day-to-day operations, what we are engaged in, that I'm leading them. And we actually look into actions coming to us. They're designed sort of on two methods of identifications. It's actions that we can identify, prioritize from the core team that makes up Vision Zero Cancer, but it's constantly to attract to relate to other initiatives. And that's also how we saw the need for starting up, for instance, a test bed for precision medicine. We've also set some criteria. We developed a process for deciding on what should we focus on. Very important for us to see how any action will contribute to achieving the 2030 agenda and our vision. So very clearly looking at goals, the purpose, expected results and benefits for the end user linked to then cancer targets and milestones. We're also looking at gender aspects in projects and also in relationship to the results and expected societal impact. We're also looking at the possibilities of the implementation of a solution and the scalability. So with that, we have our ways of guiding and how to prioritize. And this is also work in progress. We constantly iterate and to improve. But this is a little bit of some of our tools that we have developed to decide on where to go. We think also that some of the learnings we have so far, and which we also see that in our iterations together with Vinnova and the other innovation milieux that are also covering other health challenges. We've seen the importance of having an active leadership with stakeholders and persons being able to manage different interests and stakeholders, and recognizing and sort of appreciating the different logics and conditions. Everyone is needed to bring their piece to the puzzle. So it's important to understand driving forces of the individual actors and at the same time get everyone to work for the greater whole. And one of the things that we think is most important is, of course, to create the community of values and cultures based on cooperation and learning. Today's exercise is really about cooperation and learning. This is how we try to see the way going forward. So we've started to develop our culture of and values to accelerate, collaborate, transform, really to act. We need to do things. We need to try. Those who try a lot, they will succeed. Some things will work, some will not. But it's about at least trying to lead that with trust and transparency and leveraging expertise and providing a focal point of action. And just like today's meeting, it's about putting together the right constellation of people who are able to move the compass needle. So here we are then looking at the compass in the direction of working towards precision medicine. And that's how also we started a test bed. In Sweden, we see, and I think in general in Europe, we see the need for developing much more clinical trials related to precision medicine, from prevention, more of the diagnostics to treatment, so that we can actually translate that into updated health systems ready to deliver precision medicine and also to pay for it. So we have created a portfolio of actions in this new testbed that has also been now awarded a grant from the Swedish Innovation Agency on what we think are the different aspects to at least those enablers and the competences needed to move forward, where we see the combination of working and to stimulate clinical trials, new models for them, new design and technologies, working at the bedside, working with real-world data, working across regions in Sweden, so nationals to stimulate more European. To that linking, of course, precision diagnostics, but to that adding on the regulatory ethical perspectives, you need to validate the cost effectiveness and sustainability, try and test new payment models, and also all of that adapted into the comprehensive patient journey so that we can have care programs, care pathways, registries and prompts and so on aligned. And we think that by developing, testing all this, and also to that bringing the citizen and patient co-creation parts, education, competence, the data analytics and so forth, we think we could be on the right track to achieve a Mission 2030 where all citizens and cancer patients across Sweden and the EU will have personalized prevention, diagnosis, treatment and care in a sustainable and equitable way. So this is the partner constellation and network also going forward there with the whole team of Vision Zero Cancer, its partners, the Genomic Medicine Sweden initiative, which is a partnership of the 7 regions with university hospitals and the 7 medical faculties of Sweden, together with infrastructure for research, the Science for Life laboratory. We're starting off with a very important clinical trial with a consortium Megalith that started at Uppsala University Hospital, also at Sahlgrenska University Hospital, and now it's going national, together with academia, patient associations and industry associations, and the authorities, the Medical Products Agency and the Pharmaceutical and Dental Aids Benefits Agency, so that we can also work together with the regulator and the payer to try different models. And of course, with an outreach to more organizations, both in Sweden and in Europe, to make this happen. And in this respect, of course, the Horizon Europe, the ICPERMED, the European Academy of Cancer Sciences, EAT Health, OECD and OPSI are among the core partners to work on to make this happen. So by that, I want to thank you and look forward to working together so that we can make sure that all our fellow colleagues and citizens have access to the best possible and accurate prevention, treatment and care. Thank you.
Excellent. Thank you, Ebba, for describing the role of Vision Zero Cancer and their activities. Now we will switch a little bit to introduce all of you to mission-oriented innovation approach as we understand it at the OECD. So I will, without further ado, hand over to Philippe.
Good morning, everyone. Thank you very much for joining and inviting us to help you in this very interesting endeavor. I'm Philippe Larue from OECD, from the Directorate from Science, Technology and Innovation. I lead the work on mission orientation in this directorate, but I was also back in 2016-2017, I was part of the team that has done the innovation policy review of Sweden. And at that time, we discussed a lot with Vinnova and with many stakeholders in industry and research who have been involved in strategic innovation programs, in challenge-driven innovation programs supported by Vinnova. And we really saw that at the pioneer initiatives, mission-oriented policy initiative. And now we see vision-driven milieu. We kept on talking with people from Vinnova and people in Sweden, and we really see vision-driven milieus as the last generation of this type of very open mission-oriented initiative that try to find the right balance between the top-down and the bottom-up. And we are really, really now excited to be part of that and being supporting. At the same time, we will learn from you, and this is also what we are at the core of what we are trying to do now with the Mission Lab at OECD, and Piret will tell you about that. But let me first tell you about how we see mission-oriented innovation. I understand that if you are here and you are part of that Vision Zero Cancer endeavor, then you are kind of acquainted, but let's try to be at least on the same page on what is mission orientation. We take it as a coordinated package of initiatives, be it policy initiative, regulatory initiative, and all type of collective action like platforms, network, all that. Framing of those frames that frame action, and all that coordinated package of initiative is tailored specifically to mobilize science, technology, innovation, and beyond in order to address a societal challenge in a very precise way. And this coordinated package has to obey to certain requirements, so to speak. It's aimed toward ambitious and concrete goals to be met in a defined time frame. It spans several stages of the innovation cycle, from research, demonstration, clinical trials, etc., but also market launch. And it crosses various disciplines, or includes various silos, in fact, disciplinary silos, sectoral silos, policy silos between ministries, between agencies, between different communities in healthcare and in other areas. And it uses different types of support instruments. Some of them are more supply side and some of them are more demand side. And we see here that there are, in this list of requirements, there are different dimensions. Some relate to the strategic orientation, where you want to go together. Some of them are about coordination, how to align the plans of those different people with different interests around that common goals that you have set together. And then in the end, it all comes down to implementation. And if you look at that, you can tell me that all taken in isolation, all those different aspects are not very new. It's not the first time that you've done roadmaps before, and you had different council and structure of governance before, and you had different collaborative initiatives before. What really makes the essence and the added value and the unicity of mission orientation is now that all that is integrated and it's tailored to achieve a specific mission, and you have your mission right now. So now we see that in each, of course, all that is very nice, but then the real question is how you do that. How can you do that? And you see how you can imagine already, and you are confronted already with all the challenges that arise at each of these level, on each of these aspects. How to create a broad consensus on selected societal challenges, and then translate that in clear and bold objectives, and how to address that. So you're going to co-create the mission, and you're going to derive roadmaps, strategic innovation agenda, etc. And we've seen with EBA that you've gone already quite a long way into that. You're already quite advanced. How to align the plans, and here you're going to set up a dedicated structure of governance. We've seen with EBA again that in Vision Cancer you already have a steering group, you already have a core group, you already have a bureau. So, and then when it comes to implementation, you need to understand how to make that coordinated package of initiative consistent. How can that work together in a systemic way? And so here you're going to implement a tailor-made, what we call policy mix of these different types of instruments coming from different funding sources and different areas, and all that has to work together. So you can understand that there are many opportunities and many challenges, and here we are here today ready to discuss with you what are these opportunities, what's in it for personalized medicine for cancer to do mission orientation. In a very generic way, the type of, we've done a survey of mission-oriented policy and mission-oriented initiatives in many different countries, and the type of generic opportunities that we see is first that it allows higher and broader engagement of people, beyond those different silos, stronger directions toward those public goods, a stronger momentum. There is a lot of inspirations usually behind the missions and around the mission. And in terms of policy coordination, you expect less overlaps, more collective action and consistent plans across silos. Also something interesting is this very neutral, open approach where you are going to coordinate different actions to really make sure that you explore the different solutions to different problems. In terms of policy implementation, the opportunities is in this intentional policy mix, this combination of different tools, the articulation between the supply of knowledge and the demand for knowledge and innovation, of course, the pooling of resources and funding. And now in terms of challenges, there are plenty. We see that it's often difficult to set real missions, you know, that they are supposed to be bold, targeted, measurable. We see in different initiatives, we see a lot of what we call mission washing. We have to be honest. So you have to be clear about exactly what you want to do, what you want to achieve. In many cases, there is a lot of talk around transformation, but when you look what the missions are and what they try to do, in most cases, they remain very much in the science and technology side, and they don't get into, you know, behavioral change, this type of systemic change, and that is one of the limits and one of the challenge, how you go beyond science and technology. In the governance side, on the governance side, one of the challenges, of course, that this type of complex system governance involved different multi-level, cross-ministerial, cross-agency, cross-silos type of governance structure, and that can be quite complex and heavy with a lot of burden. There is a weaker engagement of non-STI, non-science, technology and innovation stakeholders. It remains very much confined to that. It's very hard to engage actors that are beyond that word, including citizens, for instance, in your case. And when it comes to now policy implementation, the challenges are this, the fact that we heard from Eba that one of your objectives is to measure your impact, and measuring impact of systemic interventions is different from measuring impacts from individual fragmented measures. And here we have to say that there is not that much methodology and tools that are adapted to do exactly that. So this is one of the challenges for you and also for us as policy analysts to try to help you design those tools for also monitoring and evaluations. And then we heard also with Eba that it was about scale up. So here, those mission-oriented initiatives often make wonders in specific part of one, in a subsystem. Then the question is, when you are there, when you have achieved those wonderful things, how to scale up. And that is really, we see that many mission-oriented initiatives are stuck at that level. And I hand over to Peter. Thank you very much for your attention.
Thank you so much, Philippe, for running us through the kind of extensive research that the OECD has been doing in the mission-oriented innovation space. Now we're really at the stage where that the OECD, we want to know what is known about the mission field, and we are embarking on kind of action research on the practicalities of actually making it work in practice. Not only about tools and methods that might work, but really contextualizing these. And really the important thing is to also make these bust silos and make the linkages between different disciplines and sectors that are needed to actually make missions work. And a lot of this is sometimes also very difficult, that we have to also address incumbent biases, because it's disruptive to establish roles between different technical capabilities and partnerships that are actually needed to fulfill a mission. So we need to actually address those structures. And it also requires a systemic change in the infrastructure and also sometimes the fundamentals in terms of how we look at data, regulation, or additional sources of funding and how we fund things to actually make missions work. But none of these should be a barrier to actually get to that goal, because the goal is worthy to achieve. So if we go for the next slide, then there are several barriers that we can and should actually address and should also avoid. So we should avoid having a really only a quick win mentality of having single point projects and small interventions without actually keeping in mind that we have a broader target to reach. So how do you actually set up a joint ecosystem-wide portfolio where those projects and activities become a single vision? We also need to have very kind of concrete actions on actor coordination to really have to address the fact that due to these existing silos, we have to actually create timing, coherence, and with different types of policies and initiatives that may hold back the mission that you're working on, or need to be aligned for the systemic change that you need to instill. Further on, we need concrete methods. You also have to look into your kind of toolbox in terms of, this is the systemic change we want to see happening, and we want to have a clear lack of concrete, clear methodology and theory of change about how do you get there and who needs to actually do what. So assigning responsibility for those tasks, and also having a coordinator, a steering role, who also keeps accountable or convinces those who are not convinced yet to actually be part of the mission, that are critical for the success of the goal that you want to achieve. And of course, creating evidence that this is actually delivering the success you want to see. Mission-oriented innovation and the missions themselves launch 1,000 ships, new practices, new goals, also economic opportunities. But there also has to be a control point of, if we have an ambitious targetable measure that we want to achieve, there has to be a control point to say, we also need to have evidence that we're actually achieving it. And this is, for the last slide as well, is all that we want to actually see in the Mission Action Lab in action. So we are looking for also for Sweden potentially to be one of our demonstration cases or demonstrators about how this could be achieved in a mission-oriented approach. To also keep the international attention on the zero vision cancer approach as well, to see those practices actually taking shape and delivering over time towards the fundamental goal that you have. So we are looking for working together with different countries, also developing in-depth knowledge about missions, but really the practical knowledge about how to get this done and how to get to the goals that you want to achieve. With this task, I'll give it over to Chiara to talk specifically about the healthcare innovation and so forth.
Thank you, Pirit and Philippe. I hope this provided an introduction to all of you to the concept of missions, what it means in detail, and to situate it more in how do we do missions in the health context. We welcome Henry Legely. He works at the University College London Institute for Innovation and Public Purpose. That is the institute led by Mariana Mazzucato, who is very instrumental in the mission-oriented approach at the European level. So give it over to Henry.
Thank you very much, Chiara. I am going to share my screen. Oh, I cannot share my screen, actually. Oh,
give it a moment.
I think this should work now. Yeah. A pleasure to be here. Thank you very much for the invitation from OECD OPSI. I'll share a little bit of thoughts of what I have observed along the way during my work at the IPP with Mariana. Firstly, a bit of disclaimers to talk about a little bit about my background so that you know where I'm coming from and what sort of observations I'm making and how my background influenced my observations. So I actually came into IPP in 2018 when I was finishing my PhD. It was looking at top-down and bottom-up implementation of antimicrobial stewardship policies in China, which is very mission-oriented, as you can imagine, but in a different way, I suppose. So coming into IPP, I thought this was a fascinating process, learning about how to apply this idea in a much broader way. But the formative experience of studying implementation in China, that sort of gives me the sort of like conceptual scaffold to try to look into this mission idea. So a brief bit about the context of mission. So there are many authors who have written about how mission-oriented policies have evolved. Actually, I think Philippe's report on mission is the best one so far. It has a rich number of literature, and it has summarized just about everything of the state of art. But the favorite paper of mine actually is written by our Deputy Director, Raila Cattell, and also our Director, Mariana Mazzucato. So they describe the evolution of mission using the frame of Nietzsche's Metamorphosis of Man. The first generation of mission-oriented policy is about the developmental state, which is about nations catching up in terms of manufacturing, in terms of industry. You've got to make sure things work, and then it's about building resilience. And then the second generation is the lion. It's about national pride in post World War II R&D. In that context, a lot of competition between nations in terms of getting the best science out there. So big bucks for big science. And then now coming into the third generation, which is what we are looking at here. They call it the child, which is about societal experimental missions. It's a bit playful, it's a bit experimental, but it's with a sort of like a goodwill at its heart. Excuse me. And then, so why is there such a shift in terms of the framing of the missions? I think we've all perhaps come across this idea of the moon and the ghetto, which is an essay written by one of the earlier economists studying missions, Richard Nelson. So he described that, if we can go to the moon, why can't we solve the ghetto? And that sort of like motivates the whole idea of thinking about using policy to create transformational societal change. But then 50 years on from the publication of the Moon and Ghetto in 1971, I think, we are still witnessing similar phenomenon in, for example, vaccine. There's still a huge inequity in the vaccine distribution globally during COVID. So mission-oriented policy becomes all the more important in this era. But in the process of looking into mission-oriented innovation policy, or MOIP, I kind of think maybe the real question is to look at the role of innovation in mission-oriented policy, where innovation plays a central part in achieving something else, rather than saying that actually we are looking at innovation policy per se. Ultimately, I think an interesting question to ask is, especially coming from the Moon and Ghetto question, is rocket science the really right blueprint for solving societal challenges? I mean, on the bottom right here, we have rocket. On the bottom left, we have on the bottom left there's rocket, and then next to it I put an image of what is called a Jugaad innovation. It's kind of like a quick fix kind of thing, but it's also a kind of innovation. It makes things work in a society. Which kind of innovation we're talking about? It doesn't always need to be rocket science. And I think that rocket science provide actually the right things in terms of thinking about the big picture, thinking about coordination. But in short, I don't think it provides the right blueprint in terms of thinking about the political economy of mission-oriented policies. And then the next thing is about implementation, which multiple panelists have already, speakers have already mentioned. It's the crucial point. And on the left-hand side here, I put in something that I came across in my PhD days. It's from 1984. There are some policy analysts trying to sum up what makes a good implementation exercise. And they listed a lot of things like external constraints. Do you have a good theory? I mean, mission always have a good theory, but that there are things that are more complicated, like dependency relationships, how to get to agreed objectives, accountability, and things like that. And because of these complexities, and I really like how Bettina put it, is a complex adaptive system, the distance between politicians and street level bureaucrats, I would say, is very, very far. And implementation is hard. There's no two ways about it. Implementation of mission is probably harder because of the fact that mission is about making those complex changes and embracing those complex changes. And sometimes I feel that maybe in my own little bubble, I feel that we don't talk enough about context, which is why I was really glad to hear about development of the milieux, which seeks to bridge the top-down and bottom-up implementation much more. And then coming on to health and missions, I kind of feel that there are two general approaches. There's a more solutionist approach, which is driven towards technological solutions. There's a more societal approach, which is driven more towards the sort of like holistic changes that we want to see across everything. I can come up with two examples to talk about each one. The UK government's vaccine task force is a classic kind of like textbook mission looking at how do you do tech-driven R&D exercise, whereas the UK's industrial strategy set out an aging society challenge. I think there are two components of it, creating 5 extra healthy years of living by 2035. And then the second component is to reduce inequality. So the VTF, because of time, I'm not going to details of it. You can check out the report. This report is very good in terms of summarizing the lessons. But the long and short of it is that as a textbook mission, this works really well. This is top-down policy in terms of coordination. This is about R&D. There's a mission champion at the government's highest level, the chief scientific advisor of the UK, Sir Patrick Vallance, because of the fact that this is quite a lot about technology. The whole mission works quite well, and it managed to mobilize actions from across the board, industry, academia, so on and so forth. So this works well, but it's not a really broad mission, is it? And also the fact that UK has a lot of industrial and economic interest really helps it to propel the whole of government approach in this specific area. And in terms of the sort of like broader societal implications, well, the UK sort of public health concerns are addressed, but not necessarily broader than UK because of the country's own interests. And this is actually a really interesting report. I really hope that people look into it. On the right-hand side, I sort of highlighted a few scathing criticisms of the state of this mission from the House of Lords Committee themselves. And the gist of it is that neither objectives are on track to be met, and the mission is not really working out well. There's a lack of clarity of who is responsible for what, lack of linkages between local and national, lack of leadership, etc., etc. It's not working out too well, and I think that runs into some of the themes that some previous speakers have mentioned, like the complexity of linking up local, regional, national, how do we make things work, etc. But I don't have time to go into that. I'll just share some concluding thoughts quickly. So firstly, it's about, after all that, I think there is a strong path dependence in mission-oriented innovation policies because its past is so firmly rooted in a technological industrial strategy kind of nature. I think it's sort of like sets a tone for what sort of policy you can do as it moves forward and how you can do it. Second point is innovation is political, which is a tagline of IPP. MOIP, I think, is an arena for a lot of the great gridlocks to demonstrate themselves in our times at really every level. This is more of an observation rather than useful advice, unfortunately. And I really do believe that the done mission is a good mission. Implementation is the boring stuff. I feel that people don't talk about implementation enough, but that may be to do with my background as a student of public administration. And across the sectors, there are different ways of doing things. Health and AI are very different. For example, countries are very different. Different countries have different health systems and different innovation systems. And we really need to look into specifics of the context to make things work. And the fourth point is about, I use the quote to see the world in a grain of sand to say that we need to put a technological centerpiece for mission. Why do I say that? Well, it's not to see the world in a nano chip or something. It doesn't have to be really high tech. Sometimes I believe you need a piece of tech at the center of mission because of the path dependence and the root of mission-oriented policies in industrial policies. But then once you have the right piece with the inbuilt societal benefit kind of implications, you can sort of like scale and emancipate the societal mission around this piece of potentially low-cost tech. Otherwise, if it's high-tech, it's too expensive. That already defeats the purpose of missions. And finally, I think that echoes with a lot of the discussions that has happened and will happen today. If it works in practice, well, it works in practice, but does it work in theory? A lot of people are already doing missions, like Bettina and many colleagues here. And the mission framing has been great. It generates a lot of attention, resources, and political will. But actually, in terms of the doing, we actually need to look into the doing part rather than the theory part. We have a lot of knowledge in doing. I think we need to dig deeper into the perspective of street level bureaucrats. And that's it. Thank you very much.
Thank you so much, Henry, for that perspective on some things to look out for doing mission-oriented innovation in health. So thank you everyone on the call for listening in. We've had a lot of information in the last 2 hours from the mission of Vision Zero Cancer to things to look out for in implementing missions, especially in health. So for the next part of the workshop, we will be asking you to be more interactive. We will go into a short break in a minute, but after that, we will come back to hear from some international examples of people who are already implementing missions. And the format for that will be 10 minutes of presentations and then 10 minutes for your questions. So we will give you 5 minutes now to process the information, get some coffee, and hopefully see you for some exciting discussions after the break. So in 5, we will go on mute, and in 5 minutes, we will start again with the international examples. Okay. I hope everyone is back from their breaks and you had an opportunity to get some coffee to re-energize yourselves. I can see some healthy eating going on there. And Hans is eating an apple. Great. Perfect. So thank you so much for your attention so far. The next part of the workshop is much more interactive. So we will hear from four different organizations who are already taking a mission-oriented approach to solve health challenges. I'm very excited to hear first from Sarah Billiards and Elspeth Langford from the Australian Government Department of Health. They are working on Australia's Genomics Health Futures mission. Then we will hear from Dr. Hubert Mislisch at the German Federal Ministry of Education and Research. He leads work on the National Decade Against Cancer. Next, we will have Kirsten van Bronzen from Health Holland in the Netherlands, who works on the Dutch Top Sector Policy for Life Sciences and Health mission. And then last but not least, from the UK, Veronika Zarnowska from Camden Council is working on some very bottom-up solutions on Camden Council's food mission. So very exciting to hear from a diverse group of people who can share their lessons in mission-oriented innovation. And I invite you, as we hear from these speakers, we'll hear a quick 10-minute presentation, and then we have planned some time for questions. So please, as the speakers speak, and when we come to the question time later, feel free to engage and find out more, because the purpose is really that everyone working in the mission space learns from each other as we are all trying to understand this emerging practice. Okay, enough from me, and over to our first speakers. That's Sarah and Elspeth. I hope the technology is working. Sarah, can you hear us?
I can hear you. Can you hear me?
Yes, you're there.
Okay, I can. I'm just trying to make sure I can get the presentation up on the screen. That's my only issue at the moment.
Mm-hmm.
I seem to be having some issues with the sharing of my presentation, unfortunately.
I'll share it for you.
Thank you.
You can speak. Okay.
So I'll just quickly introduce ourselves. So my name is Sarah Billiards, and I'm the director of the Australian Government's Mission Strategy and Innovation and Implementation team under the Medical Research Future Fund. And my colleague Elspeth Langford is also here with me to help give this presentation. So we'll just give you a brief overview of what the Medical Research Future Fund is, but then we'll focus a little bit more about the missions that we have. Okay, thank you, Chiara. Over to you, Elspeth.
Thanks, Chiara. So the Medical Research Future Fund, we call the MRFF, it was established in 2015, and the $20 billion fund is a long-term sustainable source of research funding. It aims to transform health and medical research and innovation to improve lives, build the economy, and contribute to the health system sustainability. To the next slide. So this is sort of an overview of the, say, streams of the MRFF. We're looking quite broadly at patients, researchers, research missions, which we're speaking about today, as well as research translation. It's a range of funding from basic and pre-clinical research, clinical research itself, through to implementation research that we're funding through the MRFF. The next slide. So there's 8 MRFF research missions. They range in budget, but all of them are across 10 years. The ones that are sort of most relevant, we thought today, were the Australian Brain Cancer Mission, which is 50 million from the government, but with partner funding, it's leveraged up to 133 million. And then the Genomics Health Futures Mission, which is 500 million over the 10 years. But there are a range of other missions that our team looks after under the MRFF as well. So the missions that we look after focus on an area of unmet need. They're priority led, they're planned and coordinated, and outcome focused. They're looking to harness resources across the system, which means investment, leadership and collaboration. And we use a range of innovative research approaches. So we do different grant models across the missions grant opportunities, which may be ranging from funding national consortia through to smaller incubator grants supporting individual shorter term projects. In terms of how it works, each of the missions are supported by an expert advisory panel. These are experts in the field from across Australia that are quite broad in nature. So it's researchers as well as consumers, from different backgrounds. And their role is to advise the Minister on the strategic priorities for research investment through the MRFF mission. So each expert advisory panel, they provide to the Minister through us evidence and knowledge gaps to assist in transforming healthcare. They bring to us the key research questions that, if answered, will deliver meaningful change to the patients. And they do that through developing a roadmap and an implementation plan. So the roadmap is a high-level document which has just recently been published on our health website, and I think we've got a link at the end of the presentation. It really identifies the goal of the mission and at a high level, so that we can bring everything back to this sort of high level goal of the mission. So for the Genomic Health Futures mission, our goal is to save or transform the lives of more than 200,000 Australians through genomic research to deliver better testing, diagnosis and treatment. We then sort of expanded a little to show our mission, which is to improve the lives of Australians by accelerating research that delivers more effective testing, diagnosis and treatment, facilitates the adoption of new interventions and consolidates Australia's international leadership in genomics. The roadmap also, just on the next slide, talks about the priority areas for investment, again at that higher level. So it talks about how the funding will enable faster and more effective disease diagnosis, prevention and earlier intervention, about new targeted interventions that will transform individual and population health, as well as increased community awareness and engagement and better understanding of the societal and economic value of genomics in healthcare. So you can see it's quite broad and covers both the technological side as well as the community and engagement side of things in this particular mission. We then have developed an implementation plan, which is really a strategy to guide how we will get to those goals, how we will reach that mission goals. It's a more practical, more detailed document, and it guides the research investment over the life of the mission. So there's priority areas for investment across each of the aims that are allocated short, medium and long-term timeframes. So it's 1 to 2 years, 2 to 5 years, through 5 to 10 years. And it, in some cases, will have dependencies. So some of the short-term goals will develop into longer-term goals, informed by the outcomes of earlier funding research rounds and other emerging health priorities, national, international landscape and gap analysis that come along through the 10 years of the investment. In terms of how we develop the mission strategic documents, the expert advisory panel drafted their roadmap and implementation plan. Those drafts went through an international review panel who provided feedback on the detail of the documentation. That feedback was then incorporated, and the drafts were then provided public consultation, public national consultation. That consultation consisted of some webinars run by our expert advisory panel chairs, as well as just information available online, and public submissions could be received by anyone through our consultation portal on our website. Then, receiving all of that information, we were able to finalise the roadmap and implementation plan, and as I mentioned, we've just published those on the health website quite recently, in the last week or so. So that was a very quick rundown of the missions process within the MRFF, and I'll just pass over to Saray to talk about some of the challenges for each of the missions. Saray.
You're muted, Saray.
Oh, let me check. Okay, she's, I'll keep going. So the challenges for the missions. One of the big one is managing conflicts of interest. So we've got a smaller community in Australia. It's always a comment that we have, you know, a certain smaller community to access experts, and many of the experts will want to be doing that research as well as informing us on what research we should be doing. So managing those can be a challenge, and that is why it's a benefit to have that broad expert mix, that it's not just researchers, it's people from different areas. I'm just glancing over at my other computer. Saray, did you want to jump in? No. Okay.
Yes. Sorry, can you hear me now?
Yes, we can.
I just want to check that people can hear me.
Yes, I can hear you.
Thank you. Thank you to Victoria, who just messaged me. So apologies for that. I just had some issues with my headset. So as Elspeth was talking about, it's been an interesting process for us with the missions. So apologies if I do go over a few things. So as Elspeth covered, we have 8 different missions, and they have had a different sort of evolution, if you like, and they've come on board at different stages, and there've certainly been some lessons learned. And as Elspeth talked about, managing conflicts of interest has been a big thing for us, particularly here in Australia with a small community, but I think it also impacts a lot of others as well. So having the diversity of membership is really important. The other thing that has been difficult in some ways is, and I'll talk, as Elspeth alluded to, in terms of the process of trying to finalise the roadmap and the implementation plan for our missions, it's been quite difficult to work within a 10-year time frame. So it is time limited. So it has some difficulties in terms of trying to forecast what the priority areas would be up until 10 years' time. But it's also difficult to say that there's only so many things that we can apply to for within that 10-year period. The other thing that's been very difficult is the mission budget. And you will have seen from the initial slides, the budgets for our 8 missions vary from $50 million over 10 years, which is a small amount of money, through to $500 million. So trying to work out and really define what are the key priority areas that should be targeted, noting everyone has a vested interest despite conflicts of interest, and trying to be very sort of level-headed, if you like, that has been quite difficult. So in turn, that has been also difficult to translate what the overarching goal of each mission is into short, medium and long-term investments, so that Australian researchers and their collaborators are able to apply for funding, and trying to link those short and medium and long-term priority areas to make sure it always goes back to the goal of the mission. And similarly, for some of our missions, we have multiple priority areas and multiple aims, and making sure that those aims and priority areas all connect. It's a really, really difficult task. And we just had a meeting yesterday, actually, for our Indigenous Health Research Fund. And as some of you may imagine, it's a complex area with complex health and medical research issues. And ideally, we would be able to achieve everything, but with a small bucket of money of $150 million, trying to narrow down the scope of what this mission should focus on, but also delivering on the bigger picture, the bigger investment areas, is really critical. So two more things that have been challenges as well is really trying to identify the clear metrics for performance. So really trying to work out what can we articulate in our roadmap and our implementation plan that almost holds us to account to see whether or not the priority areas that we have identified actually are attributing to the goal of the mission. And similarly, against that, I guess, is also identifying leveraging opportunities to, as I said, the funding bucket that we have is small. And so are there other ways that we can leverage opportunities within Australia and internationally that we can try to increase the impact of those missions? Next slide. So just lastly, from experience, we're still in our infancy, and I think when we were established in terms of missions and their becoming of almost a standard sort of concept, when we were established, it was at that early stage. So we certainly have learnt a lot. The establishment of expert advisory panels has been critical to the identification of what the scope and the priority areas should be for a mission. But what we have learned is to really have clear terms of reference or a clear scope for those individuals who are on that expert advisory panel, to be able to articulate to them that there's a finite budget, we really need to narrow down the scope, and we can't address everything. And what we have found with experience is that having diversity of membership does really contribute to that. And for in Australia, we have found that having international membership is critical for the conflict of interest component, but also it's just that independent person who doesn't have that vested interest who is able to contribute to the discussions around the table. Another important component, so while we have a roadmap and implementation plan that is set for 10 years, having an evaluation early in the process is quite critical to identify through the grants that we have funded, are those grants meeting the objectives of the mission? And it gives us an opportunity to either modify or slightly tweak the priority areas and the aims under each mission. So we're just starting to engage in that early evaluation process, and it's starting to shed some light. Not that there was a wrong path, but it's just more a matter of refining the path. And so that just really talks to the evaluation of the mission. And particularly for us, it's really trying to identify partners who are in the sector, not necessarily financial partners, but also partners. So those collaborations, that consortia that are able to leverage and harness and advocate for the mission, so that the impact and that there's a common voice of trying to achieve the goals of that mission is also critical as well. So thank you so much for your time, and I do apologise for some of the technical issues from us in Australia. This is just some background information for you. So if you do want any further information about the Medical Research Future Fund, in particular the missions, you can go to these websites and find some more information, or alternatively contact Elspeth and I. Thank you.
Thank you so much, Sarid and Elspeth. That was really fascinating, I thought, especially on the conflicts of interest. And I see we had 2 questions from the audience, so ask them to you both at the same time, and then I'd appreciate it if you could keep your answers to 2 or 3 minutes. Kirsten, a fellow case presenter, asked, who's able to apply for these funding opportunities? And Anne-Sophie wanted to know, how do you ensure that the approach stays adaptive throughout the 10-year timeframe of a mission? So either Elspeth or Sarid. Yep.
Sure. So in regards to who can apply, it's Australian researchers. It's facilitated through our grants hubs. Grant opportunities are opened and facilitated through the grants hubs. It can be a range of different research organisations. But yes, we're funding Australian researchers to do research.
Thank you. And how do you ensure that you stay adaptive throughout 10 years?
It is a good question. I think it's thinking about it early. So it's putting it into that implementation plan where you can. That maybe the short term is looking at those gap analyses. It's looking at what we need to do and building that into the medium and longer term priorities. We're still at the start, so we're still working out how that will go. I think the other thing is that early evaluation. So we're checking in on how those short-term priorities, whether they are being met through the grants that we're providing through the research we're funding, and seeing how that can build across into longer term goals being met through the priorities.
Thank you. I think that answered in part another question we got, which was about what are those early evaluation mechanisms for checking in on the mission?
Yes, we have an evaluation strategy that's come out for the MRFF. So that will come in more and more as we go through. There's an evaluation occurring for our Million Minds mental health research fund at the moment. So that will be interesting to see what comes out of that early evaluation as well.
Excellent. Thank you so much, Elspeth and Sarid, and thank you so much for the audience members who had questions. We do need to move on to the next speaker, but Elspeth and Sarid can perhaps answer any other questions you have for them in the chat. Or of course, you can contact them.
Yes.
So great, thank you.
Thank you. Thanks. Bye.
Okay, moving on to our next example. Dr. Hubert Mislish, I hope I pronounced it correctly. Can you hear us, and are you able to present your screen?
Yes, I can hear you just fine.
Perfect.
Can you hear me? Okay,
yes.
Good.
Over to you.
Okay, you should see my screen now, I hope.
Yes.
Okay. So just one minor correction. I'm not directly linked to the Ministry of Research. We are supporting the Ministry of Research in implementing the health research program of the federal government. And that's a public service organization at DLR. So I'm representing the ministry. They've been too busy, but they give their greetings. They are very curious about this event. And we have seen that one of the experts we're using to structure and restructure and develop German oncology is also a member of this workshop, Professor Ulrich Ringborg from Karolinska. Okay, just to give you an idea where the cancer mission, the decade against cancer, this mission is placed within Germany's overall policy, research and innovation policy. So the cancer mission is part of the German high-tech strategy 2025. The overall aim is to drive and to develop Germany's future by RNI. This high-tech strategy is addressing all very different thematic areas, from mobility, sustainability, industry 4.0, down to health. And overall, it contains 12 missions. There are 2 in the health field. One is addressing digitization of medicine, and the other one is the fight against cancer. So first, as an introduction, why are we doing this now? The reason, of course, is that Germany has developed a very strong cancer research community over the last decades. And cancer as such is a major challenge, as we all know, in modern medicine to all societies. Due to the aging population, there is a rising number of cases expected for the coming years. We are hoping that with this decade against cancer, we can contribute to fight against this major problem. The ministry realized that there is a need in Germany for a long-running multi-stakeholder initiative with a broad visibility to the general population, to the patients, to the in order to improve cancer research and cancer care in Germany. Meaning basically that we are trying to solve problems that would, without the mission, not be solved. Now, the strategic aims of the National Decade Against Cancer are to improve the life of cancer patients through fast transfer of innovations into clinical practice. That's almost the same wording as we heard from our Australian colleagues with different approaches coming from the genomic medicine field. One very concrete aim is to reduce the number of preventable cancer cases in Germany from about 40%. That's nowadays the number, every 10 years by 10%. So at the end of the decade, we should have this 40% number down to 36, and then keep going in the coming decades, even beyond the mission. Another aim is to allow access to all patients in Germany by networking cancer research institutes with cancer care hospitals at the highest quality. We want to improve communication towards and with the citizens, and especially with respect to cancer prevention, to inform the citizens on ways to contribute to prevent as many cancers as possible. And finally, one aim is to educate the next generation of cancer researchers and clinicians, of course. Now, what we launched the National Decade Against Cancer, means the Federal Ministry of Education and Research in January 2019. So we are approaching the end of the third year. We brought together numerous key players, all relevant when talking about personalized cancer medicine. So, of course, from the field of medicine, from the research field, from society, including patients, politics, the Ministry of Health is also involved. The regulatory authorities are involved, and of course also the business sector. Of course, as a decade, it's going to run for 10 years. That's pretty simple. What I forgot to mention here is, as a point or to list, is the earmark budget is 1 billion euro over the 10 years. And we are hoping maybe that could be increased if we can show that there are early successes. there is a clear focus on strengthening translational clinical cancer research, and that's a different in complementarity to the German cancer plan that is led by the other Ministry of Health, already since more than 10 years, which has a focus to improve cancer care. And there are specific important issues within the national decade. There is a focus on prevention, as I just said, very concrete aims. There is a focus on improving patient participation in the research, and there is a focus on communicating with society. Now the organization chart, underlying in green, that's the national decade. We have established a strategy committee, which is made up of all the different stakeholder groups, led by the federal ministry and by the scientific director of the German Cancer Research Center in Heidelberg, DKFZ. And that is done on the level of a parliamentary secretary. So that's just one level below the ministerial level, so very high in the political hierarchy. We have developed from the strategy committee is leading a number of working groups. I will say a few words later on important issues or important first issues. And they have also built a task force on communication. And everything is linked and organized with in the direction of the strategy committee and led by the strategy committee. As I said, the decade has a focus on research, but we are complementing what has been done within the National Cancer Plan since more than 10 years. They are focusing more on improving conditions for healthcare. They're dealing with issues of regulatory affairs, on cancer registration, and so forth. On a European scale, of course, we're trying to link and to network with the European Commission's Mission on Cancer and Europe's Beating Cancer Plan. Now, the first results of a bit more than 2 years of into the decade. As the start of the decade, all involved stakeholders have declared a common joint declaration, where they have laid out some more details on that are linked to the overall aims. So that's the next level of detail, I would say. As I said, we have established a strategy committee, task force on communication, 3 working groups, and the 3 most important issues at the beginning of the decade were on grand challenges. So what are the grand unsolved challenges in cancer research, on cancer prevention, and on networking research and care in Germany. We have also developed a concept to include supporters of the decade. That's an ongoing process throughout the decade. Interested organizations, be it from research, from care, from patient support groups, from general public, may apply to become a supporter of the decade. And that has been very successful so far. And BMBF explicitly has launched a number of first funding programs, big funding programs. The first one on practice changing clinical trials has the funding volume of a bit more than 60 million euro. The one on tumor heterogeneity, tumor evolution, therapy resistance. That's an output from the first working group on grand challenges. And that has a funding volume of about 40 million euro. Prevention of colon cancer in young and future generation. That's a focus on the prevention area, of course. And then a very big and structural program to extend the National Center for Tumor Diseases. If this is so, there are 2 centers, centers in Heidelberg and Dresden, and we are adding 4 new centers. The process of evaluation is still ongoing. The funding volume of the new extended National Center for Tumor Diseases will be 100 million euro per year. Another result is that we had a very comprehensive dialogue with the public, web-based dialogue, of course, many thousand, we collected many thousand feedbacks, individual feedbacks. One of the partner within the decade is a very large cancer charity, and they are building together with the DKFZ, the German Cancer Research Center in Heidelberg, a new National Center for Cancer Prevention. The process of this is ongoing. We have, under the the German EU presidency last year, initiated a process to define principles of patient involvement. And the final event has just been organized in the last two months. And we also strengthened Germany's participation in a so-called ERANET. That's a research funders ERA network called TransCan. Some of you may have heard about this. We have increased Germany's participation in this first call of TransCan on next generation cancer immunotherapies. Now, the challenges are pretty similar to what we already have heard from Philippe in the intro, and also by the colleagues from Elspeth and Sarit. Of course, a decade is a mission is a long-lasting initiative, and it's difficult to keep it going with all stakeholders for 10 years. It's also difficult to attract and keep the attention of the public for cancer issues for such a long time. Another issue that, of course, there are particular interests of the involved stakeholders, and it's not always easy to accommodate and align the activities of the decade with these particular interests. Conflict of interest has already been mentioned. That's one issue here, of course, as well. Then it's tricky and to keep going the common ownership of the decade. There are some partners clearly more involved than others, and that's directly linked to the benefit. The researchers, of course, are very interested because they can shape, in a way, they can shape funding opportunities, and other stakeholders may not see a direct benefit as that so clearly. Of course, there's the need to include many authorities' competences for solutions of the cancer problems, from the health, research, regulatory systems. I already mentioned that. Health insurers are involved. They have a very different approach to many issues. The public in general and patient representatives especially have a very specific approach, of course, very directly involved in these issues, in many of these issues, and industry as well. It's also a challenge to change the culture of cancer research by a stronger involvement of patients. So that is a very important issue for the Ministry of Health and Research, and Education. We really want to push also using this mission on cancer. We want to push research in general towards patient-oriented research. And that's a cultural change for many clinicians on the one side, but also for the patients, because they're not used and maybe not educated, all of them, enough to get involved so directly, up to even taking common decisions. And that's bringing me at the end of the presentation. Here is a link where you can find some information in English language. Thank you.
Great. Thank you so much, Hubert. I wonder if we have any questions. I can see here there's some discussion going on. Oh, thank you. A question from Gunilla Andrew Nielsen. Is the national drug authorities involved in any of the work streams? Let's start with that.
You mean, yes, we have two we have a drug authority that is for new medicines, and for biologicals we have a different one. That's BfArM and PEI, the Paul Ehrlich Institute. That's the one also involved in the COVID vaccine development, of course, and the I would call it the normal one, normal medicines, that's the BayPharm. Both institutions are directly involved in the strategy committee. So not only there, but also in the working groups.
We had some discussion.
I could also say maybe on a European scale, we are engaged together. We, that is DLRPT, my colleagues on behalf of the Federal Ministry, in a European project on regulatory affairs in the context of personalized medicine together with BayPharm.
Thank you. I'd like to understand more about what you said about the shared ownership, especially when it comes to patients and the public.
Yes.
I think that's shared challenge for all.
Yes. For us, it's still, well, the whole thing is a learning process, I would say. In the strategy committee, we have 2 patient representatives. In each working group, we have at least 2 patient representatives. If we are launching the calls and we are evaluating, well, in the process of preparing the calls and the themes and defining what exactly is important, we are involving patient representatives. In the evaluation of the proposals, we are involving them. In the extension of the National Tumor Center we had 2 patient representatives in the international panel, where Professor Ringborg, I may say this, is one of them, because he's well known, he's well informed about the German oncology. The thing is that mostly the clinicians are not used to listen to patients and to seriously, well, I should say they are used to listen to patients, but maybe not take their word as seriously as if it comes from a clinician, from another clinician. That is a change of culture, and that's just it needs some impact. It needs endurance. It needs to, as I said before, we need informed patients. It's sometimes tricky in evaluation meetings. Sometimes the language may be a barrier. German patient representatives, not all of them are very outspoken in English language, so it's tricky. So it comes with a number of problems, but that's one big field, which is not specific for cancer research per se, but the ministry wants to roll this out to all sorts of, to all parts of health research. We want to involve patients. We want to develop patient-oriented research in Germany.
Fascinating. Thank you so much. You can continue asking questions in the chat and address them to Hurat. And I think it's time to move on now to the next presentation. Thank you so much for that perspective from Germany.
Okay, I can put the link to the homepage in the chat as requested. Thank you.
Great, thank you so much. Okay, in our whirlwind tour, we're moving on to the Netherlands now. And this is a mission that is perhaps slightly further in, a little bit older. So over to Kirsten for this next one.
Thank you, Chiara. And it's, first of all, very nice to be here with you guys and share some, well, lessons learned and yeah, and also to learn from you. So thanks already for the speakers and the very interesting thoughts. I will give you a short presentation on our lessons learned and introduce you into our missions actually, and inform you a little bit about the investment, do a deep dive into the implementation part, and introduce you also to our field lab instrument, which we use for the implementation part. So first of all, let me introduce you to our central mission. It's not our mission, it's a Dutch mission. It's actually the mission of our parliament. The process owner of this mission is the Ministry of Economic Affairs. But this mission is designed by a Ministry of Health, Welfare and Sports. So basically the Ministry of Economic Affairs selected several departments to articulate the mission and to also be responsible for the missions. In total, in the whole policy, we have 25 missions. and they are divided into 4 societal themes. One of these societal themes is healthcare, or health and care actually, and this is the central mission of health and care, which is supported by 4 other missions, and then the subjects vary from elderly care to chronic diseases to extramuralization. Well, I can continue. So in total, we have 5 missions. And as a Health Holland is one of the top sectors, and we are not responsible for the realization of the missions alone. We are basically appointed as the coordinator of the realization of the missions. And of course, we cannot do this alone. We already were quite used to work with researchers, entrepreneurs, and governments, and we have public-private partnerships for that. But since we are really mission-oriented and working towards that missions, we work with the citizens involved on a local, on a regional, and on a national scale. So that makes in total 97 partners that really invest into this mission. In total, 1.1 billion each year. And to really make sure that the citizens are also involved and to create a new paradigm with each other, we have 17 organizations in our governance structure. Because the money I was just talking about, the 1.1 billion a year, is not freely spent. It's already allocated into several programs. So it's our task to kind of integrate that towards the mission, towards the implementation of the missions into the field labs. So of course, it's a very, very big transition, and we need new narratives. As already has been said, we need new language to believe in, a story to believe in, to follow, to share for the whole quadruple helix. So that is the researchers, government, the knowledge institutes, and the citizens. And the first chapter into that new narrative, into that new story, is co-creation. And we do that in our field labs, one of the instruments to really implement the missions. That means working with the people where it is all about. That really means working at the place where the problems also occur, where people really feel the sense of urgency. And that means also with the coalition of the willing. And again, that's on a regional, on a local, and on a national scale. And that word co-creation, we use it so much. I mean, everyone uses this who is busy with mission-oriented policies, but you can, at least I think, you can take it even in a broader perspective. And I see that happening right now when we are forming those field labs. It's not only about sharing this creation process, it's also about sharing the costs, sharing the risks for whole new governance structures, and sharing the benefits as well. And that is completely new because it welcomes uncertainty. And then what happens if you don't know the outcome? How can you apply for funding if you cannot describe exactly what is going to happen next? So for this, we need trust. And we can only build trust if we connect to each other, if we learn to know each other. So this is what we do as an organization. We facilitate the creating of the connections. And we do that between organizations on a national level, for example, and to really integrate all those programs. But we also do that, and that's maybe even more difficult, between the national, the local, and the regional level. So that basically means that we try to ask people from a ministry, for example, to come and see what is happening on a local scale and see the initiatives, see people working with the initiatives that really meet the needs. And once they are there, they all of a sudden see and feel the sense of urgency again, and they are co-creating, working together. And a model that perfectly describes the need for these connections is a multi-level perspective, basically describing the process towards sustainable transition. We have the landscape layer on top, we have the regime layer in the middle, and the niche layer on the bottom. And the landscape level literally refers to the global trends, corona, or in this case, because I'm going to focus on one of our missions, increasing number of people with dementia. The regime layer refers to the infrastructure, the business as usual, with some slight optimization changes maybe, but most of the time defending itself, keeping the way things are. And the niche, that is the incubation room, you know, the local initiatives, an incubation room for radical innovation and experimentation time. And having said that, in the niche, there is where the local initiatives meet the needs, but don't always fit into the system. Well, you must probably recognize that. So then how do we make sure that they do fit into the system if they really meet the needs and they are an answer to the big transition? So we try to swap it around. So you see, here is the landscape on top. Here the landscape is in Dutch, I'm sorry, but the landscape is on the bottom. So we start at the very niche. We start with those local initiatives. And the actors now as birds here, they fly from one layer to another to meet people, organizations from the other layers and connect, and then increase trust, and then slowly start to co-create. And then they are going to increase that group until you see on the vertical axis, I mean the horizontal axis, you see time. So as time passes by, you see they connect and connect and connect, co-create, and the group increases. So you reach a certain tipping point until the group is that big that you simply cannot go back anymore, because the group of people just wishes to continue to a new normal, towards the new narrative, towards the missions. A perfect example of this is Tante Louise. It is a Dutch healthcare organization, especially for people with dementia. And what they did was literally sharing their dream with the whole village. So they invited everyone in their own home. So that means they also get to connect with the people living there, so the people with dementia, so they could feel the sense of urgency. They shared their dream with, I would say, the baker in the corner, the municipality, a few tech entrepreneurs, a knowledge institute, the school, that kind of actors, but also with the neighbors. They shared their dream and everyone started to listen, and they asked simply, how would you like to contribute to this dream? And of course you have read the dream, but the result was much bigger and much better than they would ever hoped for. It's now literally an open village where all the residents can freely walk around. And as you know, that is very special for people with dementia, because it's not only in the early stage, but it's also in the later on stages. And that is enabled by the community and of course by technology. And as those people are walking freely around, of course, the whole cycle repeats itself, because then new connections are being made and people learn lessons and translate that or almost copy that to other contexts. And that is what we are doing right now in the Netherlands, in many places. I will try to describe this picture that you now see. On the top, you see the field labs that are now actively working together with us. And they also have the commitment on the missions. They also have the commitment on a population that they want to make impact for. And that is a population of at least 100,000 people. That's big. But that is because it's more interesting for health insurers or for entrepreneurs to really invest into a big group to really make impact. So these are the field labs that are already up and running. They are partly also financed And here are some field labs that are, well, we're trying to look whether there is cooperation possible, whether we can work actively together. And here you see a slide, we cannot put them all, of course, but a slide view of the actors, the organizations in every field lab. And there are always universities involved, always citizens really involved, always healthcare organizations, of course, always government, always health insurers. So this is what we are working on, and you now know a little bit of the process and our lessons learned so far. And well, let's join forces, because we're not only doing this on the regional and the local level, and not only on the national level, but we're doing this on an international level. So let's work together. Thank you for your attention.
Thank you so much, Kirsten. It's great to hear how these high-level strategies can make an impact at a community level. I think that's often a very tricky part of the process. As we wait for questions to come in, I see there's already one. Yeah, what are these field labs? Could you explain more? Are they physical spaces, digital meeting spaces, or are they perhaps a narrative or a framing more than a defined structure?
Well, they are most of the time more physical places. So actually initiatives that are already working together with universities, or it's most of the time already a rather big team. But it can also be digital, of course, when talking about specific patient group or a specific theme. Does that answer your question?
Could you say more about how you select or how you go from a very high level mission to a very concrete field lab?
Yeah, I can. We always jump, we literally go around the Netherlands and we see, and like not only hearing from people what is going on in a certain place, but we really go there. And we want to see how the cooperation is between the local entrepreneurs and the citizens corporations and all the other actors I just mentioned. And then if we know their dreams and we see how they connect to each other, then we are simply going to ask, okay, this is the biggest story. Would you like to, first of all, be in that community? The answer is actually almost all the time, yes. But then even further, would you like to expand your dream? And would you like to commit towards this mission? And if the answer is yes, then we have a whole infrastructure set up in which they are entering. So they also act on a national scale. And yeah, that is how they translate their activities towards the missions and translate their activities towards the national scale to show what's really going on.
Really fascinating to hear how sometimes it's something as simple as engaging with communities and asking for their input. I get lots of questions from the chat. So Volker asks, have you experienced resistance to a positive story?
Yeah, of course, especially in the field labs, because you can imagine that people from a very small village, that's where it sometimes starts, they think, yeah, you in that governmental area there somewhere, I don't know, you are then making up a story, something with missions. What shall I do with this? How are you going to convince me that you also going to do something for me? So it's really about building trust, again, between those different layers. That's a big part of resistance.
Mm. And okay, let's take two more before we move on. So Eva Marie asks, how do you set up the field lab? Are there formal cooperation agreements, governance structures?
Yeah, there are. We have 5 building stones. Wow, I don't know the translation for now, but anyways, 5 key elements which walk through the whole program. That's monitoring, that is working together, that is, I'm trying to translate, learning together, that is ICT and data, of course, and that is trying to finance it all. And for all of these key elements, you find them in every report or evaluation looking back to a transition or a pilot regarding this theme. So we simply took this as the key elements. And if you are a successful team already in your area, so you're a starting field lab, you have commitment on the missions, you have commitment on making your team more complete and also growing to that bigger amount of people, the 100.
Vad bra att du fick in artikeln.
Sorry.
You also have commitment on growing to a larger scale to 100,000 people. Then we're going to look, how are you making one of your team members, so one of the organizations, responsible for each of those key elements? And then most of the time, university is responsible for the element of learning together, and you have certain organizations coming back for every of those key elements, and building that structure that makes it able to let field labs learn from each other. So we have peer-to-peer learning infrastructures, and we also have, next to the peer-to-peer learning infrastructures, we have the national to the field lab learning infrastructure, always on this key elements. So we also have a board, all the board members of those organizations on a national level, they are also coming together to learn from each other. So we basically engage that learning process on all different levels, and that's what they have to attend in.
Mm-hmm.
Does that make kind of sense?
Yeah, absolutely. So these are existing teams, but you're making new connections in some form of structures and setting up learning between all levels. Fascinating. I just want to close with the two last questions. I'm sorry, we don't have time for more. What are your biggest challenges, and are they perhaps connected to political changes?
Yeah, they are. And the biggest challenge, I would say, is connecting the national procedures and the national way of working. So the policymakers, for instance, towards connecting them to the more local levels. That's, as is already been mentioned, that's a matter of language, but it's also a matter of tempo. Is like the local level just wants to have something fixed tomorrow, and why is the ministry not answering today? Because I want to have it fixed tomorrow. Whereas for the ministry, it's, you know, that's the difference. So building that bridge, and also letting the regional actors know that it's really, really very important to have them share their story again and again and again on the same podium. And that's frustrating for them. So we have to encourage them again, and then that is a very big challenge, and that's continuing, but it's also very fun.
Super interesting. Thank you so much, Kirsten. Again, for the audience, please feel free to keep asking Kirsten any questions you have in the chat. She can answer there. And Kirsten, if you have any links you would like to share for people to get in touch, you can put them in the chat.
Thank you, Chiara. Thank you for all the questions as well.
Great. I hope that's given you some inspiration for how to translate the cancer mission into some local action. And for a little bit more inspiration, we have a last case from the UK. Again, this is focused on implementation, local action, and bottom-up solution that hopefully can provide Vision Zero Cancer and your network with some ideas. So next up is Veronica. Veronica, can you hear us? And can you share your screen? Perfect.
Yes,
Over
thank
to
you so much.
It's a pleasure to be here. Let's see. Are you able to see my screen?
Yes.
Great. So yeah, let's kick off. Once again, thank you very much. It's a pleasure and privilege to be here and to listen to all the others. Yeah, so for a bit of introduction, I'm a policy designer at Camden Council, which is one of local authorities that forms part of kind of local administration for London. It's a borough of more than 250,000 people. And our structure, the council is made up of elected members who are supported by permanent council staff who kind of manage the day-to-day and implement the strategies and operationalize strategies that are set up. And we oversee the majority of local services, from housing through public health to waste collection. We're a central London borough, very diverse in nature, onto which I will speak in a bit more detail in a second. So what is the kind of background and context to why have we embarked on this journey to set up missions? So the starting point was the COVID-19 pandemic, which kind of made evident that the existing kind of structures and ways of working of the public sector were no longer sufficient for the scale of the challenge. So we set forward the ambition to not only recover from the pandemic, but to renew ourselves and the borough. And we were very much aware of existing structural inequalities. In Camden, there are some of the most wealthy and some of the poorest areas in the whole UK, practically next to each other. And then the disproportionate impact of COVID-19 on certain parts of Camden population, especially Northeast, became even more evident. In the particular context of health and food, again, the pandemic made the existing situation worse, while already there has been a prevalence of child poverty and school pupils claiming school meals, as well as people already suffering from kind of food security even in years before. At the same time, what's important for context, next to this poverty, Camden is a global business and innovation hub. It's a center of business, academic, research activity with likes of Google and Facebook actually having their UK headquarters. So from this tension and this difficult complex picture, we also recognize an opportunity which we felt like addressing with the missions approach. So the starting point was setting up a renewal commission, which was an advisory body outside of the council. It was co-chaired by Professor Mariana Mazzucato from the Institute for Innovation and Public Purpose, and by Councillor Georgia Gold, who's the leader of the council. Well, it consisted of a very diverse group of people from the community, from voluntary sector, from academia, from businesses as well. And the commission met for a few sessions, and what was important is that input into the commission were real life experiences, stories from our residents of what the pandemic meant for them, challenges they faced, as well as the deliberation of the commission was done using data and evidence. And through this process, the commission arrived at 4 missions for Camden's renewal around diversity, economic opportunities for young people, sustainable neighborhoods, and the last one being around food in particular. So our mission statement is, by 2030, everyone eats well every day with nutritious, affordable, and sustainable food. And through this mission statement, we really wanted to kind of pinpoint the cross-cutting nature of this challenge and of the solutions that we're looking for. So with this mission, we're addressing the grand challenge of climate emergency, of food poverty, as well as the inequalities, hence this nutritious, affordable, and sustainable goal. And how we see the missions is they're a vehicle to grow a movement. So with this visual, we wanted to show that we have started with a council decision, the cabinet of the council making a political decision to launch the commission, then engaging the partners, but we very much see it as a continuous effort for it to become shared endeavor, which becomes co-owned and driven by the community, by our rich, diverse community. So here you can see the stage at which we are now is basically we have closed the commission very recently, and the missions are being more kind of rooted into the internal mechanics of the administration of the council. And quite early on in this journey, I think it's important to emphasize that I'm very much sharing kind of the details of my sketchbook and my notebook about what doing missions actually means, as we are very much at the beginning of our learning journey. But one of the first learnings as we started to kind of unpick and think what doing with this mission means in practice was the realization of the scale of the challenge that we have in front of us. What that means for early mission delivery for the council, but at the same time having to keep developing this long-term view, long-term perspective, and there's a bit of tension emerging between those two, to which I'll speak to in a second later. But from this, definitely the learning was prioritization and kind of I think in a way, probably maybe it's good that we only realize that kind of along the journey, because maybe if we thought of writing a project plan to operationalize all of this, not sure if we would be ready for the challenge. But turns out that we are. And so how did we approach this? First, we took the roadmap that were originally created by IFP in some of their projects involving implementing missions, and we developed this tool called Mission on a Page. I'm not going to dive into the particular details of it, but with this we basically aimed to capture what are the different components, what are the building blocks, almost in a kind of mix and match form. So analyzing the layers of the mission, what is the story that we're telling, what are the issues and root causes that we need to be solved, what is the system of those problems, then what are the opportunity areas in which we can act, we meaning Polboro, not just Council, then who are the different actors, as I said, this being kind of shared endeavor. What are the tools, so levers, looking for not only of ourselves but also of partners, and finally how will we measure the success. And yeah, as I said, we're very much at the beginning of our journey. The commission has started a year ago, and we have actually just had our launch week. But I'm going to share with you the learnings that we kind of gathered so far. The first being that doing missions is very much working in conditions of ambiguity and uncertainty. You can't have a project plan when you're planning for activity that you don't yet know what it will be, and that you want to influence other actors to take roles. So you have to give up control. And communicating this is not always easy, both with internal stakeholders as well as externally. Many organizations or residents are not used to a public authority saying that we don't know something would be considered as lack of competence. So there's a lot of this storytelling around the mission, and for us as officers, it's been a journey to become comfortable. Then we recognize this tension between short-term core service delivery and this aspirational challenge-solving approach. We are working in the conditions of emergency, of a global pandemic. The food poverty is a problem now, and many internal actors have a very strong inclination for action as they result on the ground. So again, storytelling around this isn't just blue sky thinking that looks nice on paper and on slides, but that this can make a real difference. Then defining the role that missions are to play internally and externally. This never stops. This is a continuous journey. Numerous conversations are still happening around, are the missions a new project? Are the missions replacing existing strategies? Are the missions an umbrella term? Are missions more in a communication, a PR, this kind of things? A constant reevaluation, maybe they're all of it. Maybe our thinking right now is that the mission also changes and takes different roles. I think example maybe wasn't so clear to us before. Then the need for new governance structures and working across silos, establishing new kind of internal sponsorship structures, ways of working, ways of making decisions, as well as kind of speeding up of decision-making processes. I'm going to go back to this. Then a very key, crucial point for us is that doing this needs a degree of vulnerability. We need to listen, we need to deliberate, and we need to be open to criticism. Because if we really are to make this as a shared endeavor, there are many people who aren't happy with what we're doing, who think that we should be delivering services faster, more efficiently, who don't feel heard. And this, yeah, we have to be open to that, as well as diversity of us, which again is key for the inclusivity of the mission. Then moving on. The first point about moving away from service-centric way of working into kind of challenge-centric or problem-centric, and we're working with an established organization with a very established governance structures, decision-making processes, teams, departments. So it's again a continuous journey to work with internal stakeholders, convincing them that this isn't just another thing that they need to have on their plate, that this is an enabler to what their services, their separate teams are trying to achieve. And this links with this enabling infrastructure. So how do we give up power, but create conditions for different actors, the community, to act? And one example here was launching kind of bottom-up funding for initiative for residents and groups to launch their own funding up to £100 for individual initiatives. But as we launched this, we found out that we hear great ideas, but then the teams who hear those ideas are struggling to speed them up internally because of the kind of rigid decision-making process. So we're now looking at kind of a way to speed up, to kind of set up a new and traditional decision-making processes. And we're very lucky to have a leadership that gives us space and understands that these conditions of ambiguity and uncertainty. So they don't expect us to always get things right and to always have an answer to everything. They say, come to us with problems, not with shiny presentations about what went great. But otherwise, it would be very hard without kind of senior leadership and backing and continuous support, even we feel sometimes a bit lost. Then learning different roles that a public institution can play, meaning in traditional sense, the council would be seen as provider of services or providing of funding or finance. But here we can also be a partnership kind of establisher. We can be network builder. We can create that infrastructure. We can create infrastructure for learning, so stepping into those new spaces. And finally, this is probably one of the most important points, language matters. So most people that we speak to haven't heard of missions. They may not be very particularly interested into this technical framework that gets us public servants doing public innovation exciting. But how do we be mindful that this needs to be inclusive, this needs to be shared, and so basically how do we keep speaking a way that is encouraging and not discouraging and doesn't sound like another council-led strategy. And the very last slide, with this I basically just wanted to show you that we are very much still learning. So this is very recent thinking, what will be our focuses on the next 6 months? Maybe then I can bring you some more learnings, but these will be our focuses that we haven't yet fully figured out, but definitely outcomes framework, learning from existing multidisciplinary teams, but establishing them more as a formal governance structure, and then establishing a process for cross-borrow learning to bring back learnings from ourselves and partners will be our focus for the next half a year or a year. So thank you very much, and please do get in touch. I'd love to have a follow-up conversation about any of those points.
Thank you so much, Veronica. It's great to hear another perspective, and especially for the local impact of missions, how to translate that. So again, we have lots of great questions on here. I want to start with one from Philippe. He asks, how do you deal with wanting to make an impact in something where a lot of areas are at a higher level? And I assume this is very relevant for cancer, where maybe the research works maybe at an international level also.
Yes, that is a very good question, and another one that we're dealing with, and we definitely don't yet have an answer to. We are exploring kind of Camden being a very central London borough. We still see ourselves as in quite a privileged position, and we are thinking in a way of being the voice of different kind of being a voice and building a movement and being a coalition. So in that kind of visual, yeah, you should also have other boroughs, other local authorities that, yeah, indeed can operate in very constrained, especially financially conditions. Our funding has been cut by about 40% in the last 10 years. So we do try to lobby, essentially kind of lobbying central government and building coalitions for change. Yeah, but would be very, very interested in other people's also answer to that question.
Could you perhaps give an example to make it more tangible in a way in which you've worked either with the local level to provide infrastructure there or upwards?
Yes, so for example, again, we're privileged that our leader is also the leader of an organization of a group of London councils, a pan-London group that gathers more than 30 boroughs that London consists of. And then on a central London level, there are also 9 missions being launched. So that also gives us a kind of leverage and ability to reach more funds, as well as work through this regional body level.
Mm-hmm. Yeah. Very interesting. A couple of speakers have mentioned the challenge of connecting different missions at this meta level. So maybe one last question before we go into prep groups from Anne-Sophie. How do you continuously work to build resilience in your organization despite resistance and challenges?
Yes, that is a very good question. Sometimes I don't really know how we do it. The pandemic showed us what we can do and how resilient we can be when we didn't think so. I think Camden as an organization is quite good with kind of changing direction in a way. So, for example, before launching missions, our kind of core strategic initiative document was Camden 2025, and that translated into Camden Plan. So Camden 2025 was more an external strategy. It was really rooted in kind of participation and citizen voices, citizen assemblies, or Camden Plan was our internal implementation plan. And then now we're at the stage of rewriting that document and embedding missions within it, which again adds a layer of complexity and ambiguity, but that kind of helps us to essentially pivot and rethink those governance structures, those processes when they stop to serve the residents and to be fit for purpose. And definitely kind of communicating all of this and rallying the organization behind, I would say, is probably a top 3 challenges and challenges of doing this in this way, because the organization definitely is at different kind of level of maturity and different level of buy-in into this. So you need a big degree of kind of optimism and faith in this as well. That helps.
Yeah, it's interesting about the internal and external selling of mission you have to do. Thank you so much, Veronica, for that presentation and your perspective. I want to give it over to Ebba for some reflections and word of thanks before our next activity. So back to you, Ebba and Veronica, if you could stop sharing the screen, that would be great.
So I just wanted to thank all of you for sharing and being so open and transparent also where you are in your learning journey. And as you all have mentioned, we are at different stages, but have different kind of influences. And definitely I recognize a lot from all of you from what we are trying to achieve also within Vision Zero Cancer. And I'm sure also we know about research from the overview of all the different innovation areas and how we're finding our ways going forward. I really hope you can all stay on with the rest of our workshop today and tomorrow. And also, of course, we will stay in touch later on. It's been exciting to see also the chat going on here in the background, and looking very much forward to interacting with all of you. And we will come back to that tomorrow, invite for a continuing series of meetings and workshops, because as you also we're working towards a long-term mission, so we will certainly have all the opportunities to interact going forward between our countries. So thanks a lot to all of you, Kirsten, Veronica, Elspeth, Sreid, and Hubert. Thanks so much.